Hello everyone, I'm Samia. I'm an occupational therapist. I'm working in intensive rehabilitation service at NOTE. I'm going to present a case study about a patient, 93 years old, who lives alone in a house, and she was admitted due to fall and secondary to postural hypotension. Hospital and also patient has like hospital acquired pneumonia, lumbar 2 insufficiency fracture, neuropathic pain. Patient past medical history is atrial fibrillation, diverticular disease, blind, osteoporosis, and wedge fracture. This patient mobilized independently before by using walking stick and also by like tactile navigation, such as like touching the furniture, walls for orientation. She has a history of fall and three falls like last past 6 months, which actually significant risks to her mobility and daily functioning. Additionally, she faced some challenges with daily living activities like accessing the bathroom and carrying object from one place to another place. And patient has no package of care, has private cleaner who comes like twice a week for cleaning the house and has personal assistants who comes twice a week with like supporting her for bringing the food from the shop and if she needs any kind of shopping, then she support her for, like for shopping and managing her finances. Here I mention about the functional status of this patient. Previously, patient transfer, like bed, toilet, chair, like it was independent with walking stick. But when we assess the patient, we find out patient bed and chair transfer, patient need close supervision of one with rollator frame. And in toilet, a patient need assistance of one with rollator frame. Mobility patients previously mobilized independently in outdoor and indoors both, but during our assessment, we find out patient need handheld assistance of one for long distance in indoors, but short distance patient can manage with rollator frame. And in outdoor, patient is housebound. Patient housebound, so patient not like accessing the outdoor. And we find out also that like patient due to fall, patient lose his her confidence. So that's why patient sometimes need handheld support, assistance of one. In stairs, patient previously was independent with bilateral rails, but during our assessment, we find out patient is like assistance of one in stairs. And washing and dressing, personal care, patient was independent before, but during our assessment, it was like assistance of one. Kitchen task, hot drink preparation, meal prep, patient was independent before. During our assessment, we find out assistance of one. For toileting, also patient was before independent. During our assessment, assistance of one. Shopping and housework, patient was previously independent, going out, it's the community, but during our assessment, we find out patient needs support because patient is housebound, so that's why her friend assist her for this. And patient was continent before and after. We find out like during our assessment, patient is continent. So the treatment and what we provide the patient. Um, we completed washing and dressing assessment to identify the risk during bath transfer. Patient has shower over bath, so we completed the assessment, the washing and dressing assessment to find out any risk in there during the transfer. We completed assessment kitchen tasks, including transferring, carrying food from one place to another place, and all transfer we practice with the patient, bed transfer, chair, toilet, and bath transfer. We provided educations and discussion about the fall backward chaining. It's very important for patient because patient has a history of fall. So we also discuss about these things like get up safely after the fall, and we provide education and practice safe transfer technique for accessing the bath. We also like practice carrying object using a kitchen trolley, and we recommended for kitchen trolley. And we also provide education about this, how patient can use this and safe transferring object from kitchen to living room. We also provide education, recommendation provided to minimize the hazard in bathroom. Because when we assess the patient, we find out there's some hazards, so we discuss about these and we provided recommendation. Multidisciplinary working. Uh, we work together as a team. So like the other professional like physiotherapists, GP, administrative, false team, and sensory team, we all involve and we try to discuss about any issues regarding the patient to ensure that like patient is safe, to ensure patient quality of life. Uh, We measure the outcome by using a Bartle index. Patient has increased independence in her daily living activities. Patient able to access the bathroom with more ease using the bath board, grab rails, non-slip mats, significantly reducing her falls risk. During our assessment, we find out there's some patient needs some support, so that's why we provide this equipment and we provide education. We also provide the like practice with patients so that patient feels more confident while using this. And also we try to reduce the risk of falls so that like patients can be able to access the bath more easily. Patient able to transfer in bed, chair, toilet, and bath independently, and patient able to carry object from kitchen to living room by using the kitchen trolley more safely. We use some adaptive techniques, and patient agree to follow that technique that is provided by the OT. And we discussed about the energy conservation technique. Patient follow those technique as well. During washing and dressing review session, we observed patient standing tolerance and her endurance, which is improved and able to, which help patient to make independent in tasks such as bathing, and muscle strength also has enhanced the patient capacity to carry the object from the kitchen to living room using a kitchen trolley, and which help her to manage the task more safely. Patient cognitive function also improved and able to follow the instructions, organizing the task, facilitating smoother performance of activities like bathing and carrying items. And this outcome summary really highlight the specific areas of improvement and her impact on the functional abilities. End of our service, we send a referral to falls clinic for patient because patient has history of falls, so that so for this reason, for ensure patient safety in community, so that like we send this referral. So summary of this case is to like that like it highlights the critical role of occupational therapy in empowering the individual with visual impairment to manage within their environment and reduce hazard, and that help them to improve their safety and confidence in daily living activities. Here you can see there's a link of our intensive rehabilitation service website. If you wanted to know more about our service, you can check the link in the description. And also you can see there is a link about Royal College of Occupational Therapy. You wanted to know more about occupational therapy service, then you can see the link below. Thank you very much, everyone, for listening.